Have you ever caught your beloved feline friend munching on something truly bizarre? Perhaps you found tiny teeth marks on your wool sweater. Or maybe you've seen them sneakily chewing on plastic bags. This behavior, where cats eat things that aren't food, can be quite baffling. This tendency to eat non-food items is known as pica. It's more than just a quirky habit, it's an eating disorder. It means your cat is compulsively ingesting materials like fabric, plastic, paper, or even cat litter. Pica is not just a strange habit, it can be a serious concern for your cat's health. When cats swallow items that their bodies cannot digest, it can lead to dangerous situations. These non-food objects can cause internal blockages in their stomach or intestines. Some ingested items might be toxic, poisoning your cat. Other objects can cause damage to their teeth, gums, or digestive tract lining. Understanding the risks associated with pica is the first step in addressing this behavior for your furry companion's safety and well-being. So why would a cat start eating such strange things? There are several potential underlying causes for pica. Sometimes the root of the problem is medical. Certain illnesses can trigger this unusual eating behavior. Conditions such as feline leukemia, or FeLV, or feline immunodeficiency virus, or FIV, can be culprits. Hyperthyroidism, anemia, or even dental problems might also lead a cat to chew or eat non-food items. Neurological issues or brain disorders, though less common, can also manifest as pica. Beyond medical reasons, pica can also stem from dietary deficiencies. If your cat's food isn't providing all the necessary nutrients, they might try to find them elsewhere. Behavioral and environmental factors also play a significant role. Stress, anxiety, and boredom are major contributors. Sometimes it's a coping mechanism for your feline friend. Recognizing pica in your cat involves careful observation of their behavior and environment. The most obvious sign is, of course, directly witnessing your cat eating non-food items. You might see them chewing on and then swallowing pieces of fabric, plastic, or string. You may also find evidence around your home, such as plants with bite marks, or you might notice your favorite shoelaces are suddenly shorter. Small, chewed-up pieces of objects might appear in areas where your cat spends time. However, not all signs of pica are so direct. Some can be quite subtle. Your cat might start vomiting more frequently than usual. Diarrhea or constipation can also be indicators, especially if an item is causing a partial blockage. Any unexplained changes in their eating habits, digestion, or general demeanor warrant closer attention and a discussion with your vet. If you suspect your cat might have pica, a visit to your veterinarian is absolutely crucial. Don't try to diagnose or treat the problem on your own. Your vet is your partner in ensuring your cat's health. During the consultation, be prepared to provide a detailed history of your cat's behavior. Explain what non-food items they seem to be eating. Describe their diet, their home environment, and any recent changes. The vet will perform a thorough physical examination. They will check your cat's weight, teeth, and abdomen. To get to the bottom of pica, your veterinarian may recommend several diagnostic tests. Blood tests are commonly performed to identify underlying medical conditions. X-rays or an ultrasound of the abdomen are often necessary to reveal if your cat has ingested a foreign object. In some cases, tests for specific infectious diseases like FeLV or FIV might be recommended. These tests help pinpoint the cause, guiding effective treatment. Once a diagnosis is made, the treatment for pica will focus on addressing the underlying cause. If a medical condition is identified, your veterinarian will prescribe the appropriate treatment. This could involve medications, specific therapies, or even surgical intervention if there's a blockage. If dietary deficiencies are suspected, the vet will guide you on making necessary changes. This might mean transitioning your cat to a higher quality commercial food, or they might suggest a therapeutic diet formulated for specific needs. Sometimes adding fiber or specific supplements to their existing food can help curb the cravings. Managing pica, especially when it's behavioral, often involves enriching your cat's environment. Boredom and stress are significant triggers, so providing mental and physical stimulation is vital. Offer a variety of interactive toys like feather wands or laser pointers. Puzzle feeders can make mealtime more engaging and satisfy their hunting instincts. Schedule regular dedicated playtime with your cat each day. Consider adding vertical spaces like cat trees or shelves. A stimulating environment helps keep your cat happy, occupied, and less likely to seek out inappropriate items to chew. Another important aspect of management is to remove or secure tempting non-food items. Make your home as cat-proof as possible. Keep clothing, blankets, and wool items stored away. Ensure electrical cords are covered or tucked out of reach. Secure plastic bags, rubber bands, and other small, enticing objects. Provide safe alternatives for chewing, such as cat-specific dental chews or durable toys designed for this purpose. If stress is a factor, try to identify and minimize stressors. Using calming pheromone diffusers can also be beneficial in creating a more serene atmosphere for your anxious feline. Preventing pica, or managing it long-term, involves consistent care and attention. Regular veterinary checkups are essential for early detection of any potential health issues. With patience, understanding, and a collaborative approach with your vet, your cat can still lead a wonderfully happy, healthy, and fulfilled life, free from dangerous cravings.